Hi, welcome to Nursing Delegation 101. In this training session, you will learn what delegation is, how and when to delegate, and what procedures we can and cannot do. First, let's learn some terms. Controlled act. Acts that are seen as potentially harmful if done by an unqualified person. Scope of practice. The roles and responsibilities that an authorized, competent healthcare professionals can perform.
Which controlled acts can be done and to whom? Both registered nurses and registered practical nurses are authorized to procedures below the dermis or mucous membrane, administer a substance by injection or inhalation, put an instrument, hand or finger beyond the ear canal, nasal passages, urethra, labia majora, and dispense a drug.
So we know what can be done or is authorized to RNs and RPNs, but what about initiating a procedure under the controlled acts?
RNs can initiate procedures such as wound care below the dermis or mucous membrane by cleansing, soaking, irrigating, probing, debriding, packing, or dressing, and venipuncture to establish peripheral intravenous access and maintain patency when the client requires immediate medical attention, as well as procedures that involve putting an instrument beyond the client's nasal passages, larynx, or opening of the urethra, as well as an instrument, hand or finger beyond the individual's anal verge into an artificial opening into the client's body or labia majora. On the other hand, RPNs can initiate wound care below the dermis or mucous membrane by cleansing, soaking, or dressing, and for the purpose of assisting with health management activities, a procedure that involves putting an instrument beyond the client's nasal passages, larynx, or opening of the urethra, a hand or finger beyond the labia majora, an instrument or finger beyond anal verge.
Now, we know what controlled acts can be authorized and initiated by RNs and RPNs according to their scope of practice. But what is delegation? Delegation is a formal process where the delegator, usually a healthcare provider who has the authority and competence to perform a controlled act procedure, delegates or hands over the authority of the task to a delegatee, who is another individual or care provider.
Take note, nurses can delegate and accept delegation if they are registered in the general, extended, or emergency assignment classes, can only delegate acts that they are authorized to perform, and only accept delegation from regulated health professionals. RNs and RPNs cannot delegate the controlled act of dispensing a drug. Remember, a nurse who delegates a controlled act is responsible for the decision, cannot sub-delegate a task already given to them, and delegation can be oral or written, with appropriate specific aspects of delegation to be recorded. See CNO's authorizing mechanism documentation. How about delegating to UCP, or unregulated care provider? For procedures below the dermis or mucous membranes, family member or member of household or other paired care providers are required delegation according to CNO's Working with Unregulated Care Provider 2013 document. However, go by institution policies. Always refer to CNO's delegating guidelines and your institution's policies. Now, let's effectively delegate. Here are 6 steps for effective delegation. Step 1. Deciding what to delegate. Consider, what is your scope of practice? What controlled acts are you authorized to do? If you cannot answer these, check your hospital policies and refer to CNO's 2015 authorizing mechanisms. Step 2. Select the delegatee. Consider, is the delegator a regulated or unregulated health provider? Is the delegatee's skills sufficient for the task, or is extra training needed? If you cannot answer these, refer to a CNO's authorizing mechanism or working with unregulated care providers or your hospital institutions. Step 3. Delegate task. Consider, does the task meet the 10 requirements of delegation? Can you describe the task in detail and offer an explanation for selection? If you cannot, refer to your institution policies and CNO's 2015 authorizing mechanism. Step 4. Assess and discuss. Consider, are both delegators and delegatees involved in the delegation process? For the delegatees, how might learning new responsibilities affect overall workload, and what levels of authority are involved? If you cannot answer these, refer to your hospital policies or the CNO documents. Step 6. Completion of the task. Consider, evaluate, what are the team's successes or shortcomings of the completed tasks? Refer to your hospital policies and CNO documents. Congratulations, you have effectively delegated. For more information, see the delegation documents with College of Nurses of Ontario, the Regulated Health Professionals Act, and your institution policies. Thank you for watching.
Created using Powtoon.